Hi James, it looks like I have you in for a scalp exam and kind of ear cleaning today.
Yep.
I saw that you've been having a little bit of trouble with your hearing.
Yeah.
So that's something that we will take a look at, as well as looking at your scalp and kind of head overall to make sure that there's nothing abnormal going on.
Okay.
I know you've been having some itchiness and tingling sensation of your scalp as well, so
Yeah.
that's also something that we will look at. So I'm going to go ahead and get my gloves on so that we can get started. Give me just a second.
Sure.
And because we will be having a pretty in-depth look at your ears today, I am going to go ahead and apply a set of sterile gloves.
Okay.
And I'm just going to set this on your chest for a second, and then the sterile gloves will just ensure that we aren't spreading any bacteria to your ear. So excuse me while I wrestle these on. Okay, so let me get this out of the way. And I'm going to go ahead and place a cloth under your head just to protect the equipment. So if I could just have you raise your head for me.
Sure.
Perfect. Go ahead and relax your head. All right. Is that comfortable for you?
Yes, it is.
All right, so let's go ahead and start by having a look here. I have a couple different lights that I'll use, and to start I'm just going to use a regular Penlight and just have a look at your hairline and see if there's anything really notable. So the symptoms you've been having, according to your chart, are a little bit of itchiness of the scalp as well as a tingling sensation. Can you tell me a little more about that?
Yeah, I have been scratching it. It has been pretty itchy.
Okay.
And then when I go to wash my hair, I do get some tingling sensations as well.
Okay. And is the tingling sensation all over your head or only in certain parts of your head?
It's only in certain parts.
Okay, can you tell me where?
Kind of in the front, in the middle.
Okay, so like this region mostly?
Yes.
Okay. And you said mostly when you're washing your hair. What are you washing your hair with?
I do have a Head and Shoulders dandruff control shampoo.
Okay. And is that something new that you started using, or is that a normal part of your routine?
It's my usual shampoo that I've had.
So it's not anything different that you've just started recently. I just have a little comb here that I'll be using as well.
Okay.
Okay, so no new products, no new gels or anything like that?
No, nothing.
Okay. And have you started using a new face wash by chance?
No, I have not. It's been the same face wash.
So it's unlikely that this is caused by a product that you're applying topically. Could be something that's happening internally. Did you change your diet recently? Have you eaten anything consistently that you don't normally eat?
No, there's nothing that I can think of.
Okay. And the tingling that you're feeling, is it like a numbness or kind of like the tingle you feel when you have something that has menthol in it placed on your skin? Can you kind of describe what exactly it feels like?
It is like the minty, menthol, tingly sensation.
So kind of a coldness.
Exactly, yes.
Okay. Interesting. And that's not something you experienced before?
No, it has not been.
Okay. And can you tell me a little bit about the hearing loss that you've been experiencing? I read that it was just kind of something you've noticed gradually, but it's been getting a little bit worse.
Yeah, I just noticed that I have to have the TV up a little bit louder than what I usually do.
Okay.
I think sometimes I hear the outside exterior sound louder than the closer interior sounds.
Okay.
So I've been trying to compensate for that.
Have you noticed any difficulty hearing people speak, or in rooms where multiple people are speaking, are you having trouble kind of differentiating from one voice to another?
It's very possible. I just feel like I hear things that are farther away more clearly than things that are directly in front of me sometimes.
Okay.
in a crowded room setting, that would be an instance that would take place.
This is also new for you, correct? That's not something you've experienced before.
No, it's not something I've experienced before.
Okay. Well, so far I am seeing a little bit of flaking of the scalp. It looks like you might have either some dandruff or possible scalp psoriasis happening. So something that we might need to look at a little more closely. It could just be that you've possibly been using your Head and Shoulders too long and therefore your scalp has become used to it, which does tend to happen with topical products.
Okay.
So sometimes the scalp will become a little too used to the products that you're using and they stop working quite as effectively, in which case we would just maybe prescribe you something a little bit stronger for a couple months, and then you can switch back to the Head and Shoulders and hopefully it'll continue to work for you.
Okay.
So I'm just using a little bit of a different light here to have a look a little further in. Let me know if any of this causes you any pain or discomfort, okay?
Okay, that's fine so far.
So I'm really not noticing any open areas of concern. There's no areas of broken skin or anything that I can see is really concerning. I do see just a little bit of that flakage, mainly kind of directly in the hairline, like you said.
Okay.
It's definitely a little bit here. It's looking more like just regular dandruff to me than anything more serious, which is good news.
Okay.
So it's likely that your shampoo is just no longer meeting the needs of your scalp, which is okay. You've been using conditioner regularly?
Yes, I have.
Okay, good. So I have a different brush here that I'm going to use to just dislodge some of those looser flakes. And I will go ahead and prescribe you a dandruff medication shampoo. So it's very similar to Head and Shoulders, it just has a stronger percentage of the medication in it. So over-the-counter shampoos that are used to treat dandruff can only contain so much of the percentage of medication that we use to treat dandruff.
Right.
Otherwise you have to have a prescription.
Okay.
So I'll go ahead and prescribe you something. It's still pretty mild. The smell can be slightly off-putting, just as a warning. Head and Shoulders does add fragrance to their shampoo. The shampoo that I'll prescribe you is not fragranced. So the smell is a little bit chemically, and that's just the medication itself. But it should help soothe some of this itching and definitely the tingling sensation.
Okay.
So the directions are on the bottle, but I would like you to use it twice a week at least for the first 2 weeks. And then after that, once a week should be sufficient. If you wash your hair more frequently than that, which I really don't recommend, you can just use a regular shampoo. You don't have to use it more than once a week after that, okay?
All right.
So that should start to calm some of this down within the first couple of washes. And the bottle is a 3-month supply, so I would use it until the bottle runs out, and then we can try switching you back to your normal shampoo and seeing how that fares. If after that you still need it, then we can think about maybe renewing the prescription, okay?
Okay.
So as far as the tingling, I believe it's just because some of these areas are slightly irritated from the flaking, which is causing you to have some increased sensitivity, which is why you feel the tingling when you wash your hair.
Okay.
Most dandruff shampoos contain just a little bit of menthol, so that's why you're feeling that kind of cold sensation. So I do want to do a little bit of ruling out of some neurological symptoms here, just to rule out any deficiencies and make sure that we're not missing anything that could be a larger problem, okay?
Okay.
So what I'm going to do first is just very briefly test your sensation. I want to make sure that we're not missing anything that could be going on, any misfiring of the neurons that you have in your scalp, that kind of thing. I really don't think that's what's going on, but it doesn't hurt to go ahead and test it. So I have a little tool here that just looks like a big Q-tip, and I'm just going to very gently touch a couple different parts of your scalp, mainly on your hairline, and I want you to just tell me if you can feel it, okay?
Yes.
So just as a kind of control area, can you tell me if you can feel this here?
Yes, I can.
And this here?
Yes, I can.
Perfect. So it should feel just like that on your scalp, okay?
All right.
So keep your eyes closed for me and just say yes if you feel it.
Yes. 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 Yes.
Perfect. Now this is going to feel slightly different. Can you feel this?
Yes, I can.
And this here?
Yes, I can.
Perfect.
Yes. 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 Yes.
Good. Now can you tell the difference between this and this?
Yes, I can.
Perfect. So let's say this is dull and this is sharp.
Okay.
Just label them as you feel, okay?
All right. Dull. Sharp. Dull. Dull. Sharp. Sharp.
Perfect. And can you feel in here?
Yes, I can.
Does this feel sharp to you?
A little bit, yeah. Yes.
And if I just separate out an area here so your scalp is more exposed, you feel this?
Yes, I can.
Okay. Does this feel sharp or dull?
Dull.
Okay, sharp or dull?
Sharp.
Good. Sharp or dull?
Dull. Dull. More dull.
Good. Okay. So this feels sharper than this?
Yes, it does.
So you do have very thick hair, which is inhibiting some of that sensory component, but you are able to feel which side is sharper, which is good. And here, sharp or dull?
That feels dull.
Sharp or dull?
Dull.
Okay. I'm going to use something that is maybe a little more distinct. Let's see. So can you tell me if this feels sharp or dull?
Sharp.
Good. And here?
Sharp.
Good. And here?
Sharp.
Good. Here?
Sharp.
Good. And all along here should feel pretty sharp.
Yes, for sharp.
Okay, so no difference of sensation here versus here.
No.
Perfect, okay. So it doesn't look like there are any sensory abnormalities of your scalp. So like I said, this is likely just related to the kind of overuse of your shampoo, okay? So that should take care of that. Do you feel like you need any sort of topical solution on your scalp now, or do you think you're okay?
I think I'll be okay.
Okay, so it's not so sensitive that it's kind of bothering you all the time,
No.
more so just when you wash your hair.
That's correct.
Okay. So let's go ahead and move on to check your ears.
Okay.
I'm going to have a brief look at them overall just to see if there's anything that I see on the outside.
Okay.
And then depending on how that looks, I'll probably go ahead and proceed to a brief hearing test so that we can compare that to the secondary hearing test that I will do after your ear cleaning is complete, just so I can see if there are any differences there, okay?
Okay.
So I'm gonna go in with my Penlight here, and I'll start on the left side. If I can have you turn your head slightly to the right.
Mm-hmm.
Perfect. And just using my Penlight to have a look at the external part of your ear canal. So just having a look at the different anatomy here. Just having a look at the lobe and making sure that it is intact and that I don't see any abnormalities in the texture of the skin. Just appear to be a little bit dry. I'm just going to fold your ear back so I can have a look behind. A little bit of dry skin, but not noticing anything concerning. It does appear that you wear glasses, so you have an indentation from your glasses here. You wear them full time?
Yes, I do.
Okay. So that's something I see pretty commonly amongst my patients who wear glasses. So I'm going to look a little further in your ear. I'm definitely seeing some signs of dry skin. A little bit of flaking happening. Not noticing any excess of earwax. Nothing that's protruding out into the outer ear canal, which is good. Any pain or discomfort as I'm touching your ear?
No, none at all.
None of that hurts at all. If I push on the pin, I hear no pain or pressure there?
Nope, not at all.
I'll have you turn your head to the left for me so I can have a look at the other side. And again, just looking at the external part of the ear. A little bit of dryness on this side as well. Okay. Maybe not quite as dry as the other side. Alright, so everything externally looks pretty normal. So let's go ahead and proceed with a very brief hearing test and see how you do. And see if there's any difference after we do a little bit of a cleaning of your ears. I didn't notice any earwax that's protruding on the outside, but I've not looked inside with the otoscope yet. So let's go ahead and test this quickly and see how you do. So I'll have you keep your eyes closed for me. And the very first test that I'm going to perform is with a tuning fork. So it's just a metal object that's going to make kind of a ringing sound. So just as a test, I want you to tell me if you can hear this. Okay, so I'm going to do that again. I want you to tell me if you hear it equally on both sides.
Yes.
Good. Now tell me what side you hear it on louder.
The right side.
Good.
Left side.
Good. Now tell me when it stops.
It stopped.
Good.
It stopped.
Perfect. I'm going to move it kind of directionally, and I want you to just state where you hear it, okay?
Okay. Right side.
Good.
Left side.
Perfect. So you were able to hear all of that pretty well. So let's move on to a different tool. And at this time I'm going to use a little bit of a kind of scratchy sponge, and you're just going to hear a very soft rustling sound. Okay, so I want you to just say yes if you hear it.
Yes. Yes.
Good.
Yes. 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 Yes.
Okay, so no inconsistencies with that. So the next test is going to be with a very soft puff of air, and this one can be slightly difficult, but in order to inhibit you from just feeling the puff of air, I want to isolate that sound capability. I'm going to cover your ears in this little device, which kind of looks like a tiny hairnet.
Okay.
So I'll just be placing these over your ears, just temporarily. And basically these are just going to block your ability to feel the air.
Okay.
So it helps prevent you from saying yes if you're not actually hearing the sound. Okay, so now that you look like a miniature lunch lady, we will proceed. Okay, so can you hear this here?
Yes.
Okay, so just say which side you hear it on.
Right side. Right side. Right side. Left side. Left side. One more time. Think left side, but almost both sides. Left side.
Good.
Both sides. right side, right side.
Yep. So this one is going to make a much quieter sound, and it will be significantly more difficult for you to hear, okay?
Okay. Right side.
Good.
Right side.
Okay.
Left side. Left side.
Good.
Middle.
Okay. So now I'm going to make a sound on both sides.
Okay.
It might just be the left, it might just be the right, it could be both. Just try to tell me what you hear, okay?
Okay. Right side. Left side.
Okay.
Right side. Both sides.
Perfect.
Left side. Right side. Right side. Left side. Both sides.
Good. Okay. So there were just a couple of inconsistencies there. And the inconsistencies are pretty equal on both sides. So it's not that your hearing is lacking on one side versus the other, which is good news. So I think as far as the hearing test goes, that should suffice. Gives me a little bit of an idea of what might be going on, and I think although we did not see any excess earwax protruding outside the ear, when I have a look inside with my otoscope, I have a feeling that there will be a little bit more in there. So I'm going to go ahead and do that now. So this device is called an otoscope, and essentially it's just a lighted device. So you can see the light here, and it's going to allow me to look inside your ear through this little window.
Okay.
So it shouldn't hurt. It might be slightly uncomfortable, only because it tickles the inside of your ear just slightly, okay?
Okay.
So I'll have you turn your head for me, whichever way you prefer. I do have to look in both sides.
Okay.
And I will be coming just a little bit closer to you, okay?
Okay.
So, just having a look. So I'm gonna, if you can, if it's comfortable for you, have you tilt your head just a little more. Is that
Sure.
okay?
That's fine.
Having a look in the ear canal. Ear canal is very clear. So I am able to see your tympanic membrane, and it's not occluded at all. It is kind of a pearly gray color, which is normal. It does appear that you have maybe just a little bit of excess earwax. It's not too much. It is normal in color and texture. Okay. You have quite a bit of hair in your ear, which might be the cause of the problem. Okay. Any pain or discomfort here?
No, not at all.
So if you turn your head the other way for me, let me have a look in the left here. And just comparing both sides. This side maybe has slightly more earwax. But again, ear canal is clear, tympanic membrane is visible, and appears normal in color. So nothing is really acutely abnormal. You do have a little bit of excess hair growth in your ears. So everyone has hair in their ears. They're very small, kind of peach fuzz texture hair. And they're job essentially is to protect your tympanic membrane and protect your ear canal from any foreign bodies being able to enter inside. It protects from dust and debris and that kind of thing. So you just have a little more than what I would say is average,
Okay.
which could be the cause for some of that hearing loss. And it's not the hair itself, but just like the hair on your head, it sheds periodically, and it looks
Right.
like you have a little bit that may be built up and stuck in the wax that you have in your ears. Okay.
All
So
right.
just a little bit of debris in there, and we can go ahead and take care of that today.
Okay.
So I'm going to start with just a simple cleaning of the outside of your ear, and then we'll kind of work our way inside, okay?
Sure.
So why don't I have you turn your head to the right side, and we'll start on the left. So turn your head as far as you can that's comfortable to you.
Okay.
Perfect, okay. So multiple tools here. I'm going to start off with just simple gauze sponge, and it's going to allow me just to clean the area. So I have a little syringe here that I'm going to use to siphon some rubbing alcohol.
Okay.
So this is just 70% isopropyl alcohol, and it'll allow me to disinfect the external ear. Okay. So this is going to be a little cold, but shouldn't be painful or uncomfortable at all, okay?
Okay.
Okay, so now that the external ear is clean, I'm going to start by doing a little bit of manual exfoliation. So I'm just going to put on my loops here, and this is just going to allow me to see a little bit better. I have several tools that I'll be using, and to start I'm going to go back to that little scrubby sponge. So I'm just going to be using this to kind of scrub certain parts of your ear, and to do that I'm going to be using a mixture of that alcohol as well as some sodium chloride, which is just salt water essentially, so sterile salt water. Perfect. Okay, so this is going to be fairly cold. And this is just allowing me to kind of manually exfoliate some of that dry skin off so that we can start fresh. Is this painful at all? Is the alcohol okay?
Yes, it's fine.
Okay. This might be a little ticklish going into the smaller parts of your ear here. And obviously not going in the ear canal, but I will just kind of clean the outside. What I would like to do now is go in with this small scraping tool. So this might look a little odd, but it's a very tiny spatula, and this is just gonna allow me to scrape off some of that excess dry skin, okay? So I'm gonna go ahead and look with my loupes here. Okay, very good. Doing really well. Good. Getting most of this dislodged, just a little bit of dry skin that you did have on the outer ear canal here. Okay, so what I'm going to do is use the otoscope once again, and this time I'm just going to open the viewing window so that I can insert my tools gently into your ear canal, okay? So I'm just going to come a little further over to the side here while I insert this into your ear, and just let me know if this is uncomfortable. Just removed a little bit of that excess earwax. You don't have much. Okay. So I was able to remove the excess that you had. There wasn't much, but Some of that excess hair did come off, which I think should help. So I'm going to go ahead and just wipe that away. Feeling okay?
Yes.
So again, using my syringe here to just gather some alcohol. Perfect. A little bit cold liquid there. Perfect. You're doing so well. Now I'm going to use this cotton swab here, and obviously while you're at home I do not recommend the use of cotton swabs or Q-tips. Simply for cleansing purposes, I'm going to be using this at the very external part of your ear canal. I'm not inserting it into your ear whatsoever, just getting any wax that I might have missed just here in this area, okay? So the reason we don't recommend using these at home is because people tend to insert them too far, in which case you're simply pushing the cerumen or earwax further into your ear, which is leading to more of an issue than it's solving a problem, okay? So a lot of people think the Q-tip should be used to clean the wax out of your ear, but if you think about it, the shape of a Q-tip is not meant to pull things out,
Right.
It pushes things in further. So which is why when we're using tools to remove earwax, we use something spatula shaped or a suction device to remove earwax, okay? So always something done you want to have professionally and not something you're attempting to do at home. Cleaning the external part of your ear, however, is very important, and you do definitely want to keep up with that. So the last thing I'm going to do, just to make sure there's no excess alcohol or sodium chloride in your ear, is use my suction device here. So I have what's called a Yonkauer, and this is just going to go gently in your ear just to remove any of that excess liquid, okay? So this is going to be a little loud. I do apologize. It'll only take about 5 seconds, okay? So as soon as I insert it, the suction will activate and you'll hear a kind of a loud suctioning sound, okay? Okay, so inserting into your ear and the suction should be on. Okay, perfect. So we did get a little bit of that excess liquid out, which is perfect. You feeling okay?
Yes, I am.
Okay, good. So I'll have you turn your head to the left side. Let me just give you a little tissue. I apologize. I know that ear cleaning can make your eyes water.
It's okay.
Same thing on this side. So just going in with my alcohol to start. So it's going to be a little cold, okay? Just appear to be a little bit of excess dust on this side. Do you sleep on your left side by chance?
I do, yes.
So what we find most commonly in my patients is that whatever side you tend to sleep on, the ear typically is cleaner. So the reason for that is you're laying on this side and this side is exposed all night long. So nighttime, when you're not moving as much, as when the dust and debris kind of has time to settle along your ear. So that's why I typically find that the side my patient does not favor is usually just slightly dustier or dirtier than the other side. So that is normal. I'm going to go back in with our little sponge. And again, just mixing that with a little bit of sterile water. Okay. Discomfort here, James?
No, it's okay.
Good. So I'm going to go back in with that little spatula that we used earlier. Great. Just removing this excess debris that's sitting at the surface of the skin, and sodium chloride really allows it to soften. The salt and the sterile water helps kind of loosen up anything that might be sitting on the surface of the skin. Good. So I'm going to go back in with the little lighted spatula tip here. Just make sure we didn't miss anything, especially in this little corner that's really hard to get to. Perfect. Okay, so I am going to go in with my otoscope and have a look back inside this ear and see if I can remove just a little bit of that wax, okay? So again, let me know if this is uncomfortable for you. That feel okay?
Yes, it does.
Good, okay. Okay. Just bear with me here. was able to remove the excess wax that you had on this side, which was just slightly more than on the other side, okay? Perfect. So let's go ahead and clean that up for you just a little bit. So use just a little more alcohol because this side did have just a little more wax than the other side. Any pain or discomfort here?
No, it's okay.
Okay, perfect. Okay. Just using a little bit more of that salt water here. Perfect. Good. Okay. So if you will just return your head to midline for me for just a second.
Sure.
Okay, James. So I'm just gonna use a dry tissue here to make sure that your ears are nice and dry. All right, so let's go ahead and just suction out any of that excess liquid. So again, you're gonna hear a suction sound for a couple of seconds, okay? So just gonna insert that into your ear. Okay. Good, very good. And does that feel okay? You don't feel any excess liquid hanging out in your ear? Okay. So let's go ahead and repeat that hearing test and see if any of those abnormalities kind of satiated here. So this time I'm going to make a sound with my gloves.
Okay.
Kind of soft rubber sound. I want you to say yes if you hear it, okay?
Okay. Yes. 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 Yes.
Okay. So now I'm going to make the sounds on both sides. I want you to tell me if you hear any difference from one side to the other, okay?
Okay.
Same or different?
Same.
Same or different?
Same.
Same or different?
Same.
Same or different?
Same.
Same or different?
Just one side.
Good. Same or different?
Just one side. Same.
Good. Okay. So now let's do the puff of air again, and this time I'm gonna do both.
Okay.
So I want you to tell me if it's the same or if it's different, okay?
Same. Same.
Okay.
Same.
Okay.
Just one side. One side.
And can you tell me which one of these is louder? This will be 1, and this will be 2.
1, 2. 1, 2. 1, 2.
seems like your hearing has improved. I do want to do the tuning fork test again. So just tell me if you can hear this equally on both sides.
Yes.
What side do you hear this on?
The right side more? Left side? Left side?
Tell me when it stops.
Stopped.
Tell me when it stops.
Stopped.
Can you hear this here?
Yes.
Okay, so if this is 2, which is louder, 2 or 1?
1.
Good. Can you hear this here?
Yes.
Okay, which is louder, 1 or 2?
2.
Good. Okay, so looks like all of that has improved. And you're not experiencing any discomfort or anything in your ears at this time?
No, I'm not.
Okay. So I would say you are good to go for today, James. If you still feel like you're having any abnormalities with your hearing, mainly like you said with the outside sounds or when there are multiple sounds, I do want you to let me know. We might need to do possibly a head CT to see if we can look internally and see if anything is going on in the ear canal itself. You do have several tubes inside your ears that sometimes become clogged or irritated. It doesn't appear that you have an ear infection, but if the symptoms you're having don't subside, I would like you to let me know.
Okay.
And then as far as your scalp is concerned, I will send you home with a trial size of that prescription shampoo, and then you can pick up the full size at your pharmacy at whatever time is convenient for you. I will send over the prescription electronically.
Okay.
Okay, so if there's nothing else that you would like to discuss with me today, I would say that you are good to go. And then obviously if your symptoms do not subside, just let us know and we'll have you back in, okay?
All right. Thank you.
Thank you so much. Have a good evening.
You too. Thank you.